Stomach cancer awareness is a very important issue which we need to discuss. Stomach cancer is cancer of the first part of the gastrointestinal tract. When we eat food, there's the food pipe, and right after that, the first storage area is the stomach. This is where food actually gets mixed up with the digestive juices in the beginning. The gastric acid is there, which kills off some of the bacteria here. Some of these foods start to get absorbed here, but mostly the function of the stomach is to mix and begin the digesting process. We also have some enzymes here like pepsin, which helps in reducing the in protein digestion. Stomach cancer happens because of a lot of lifestyle associated issues. Smoking is very important because smoking, in addition to other cancers like lungs, food pipe and bladder, stomach is another area where it can hit because there are hydrocarbons which can be toxic to the stomach. Since stomach is the first area of contact, many of these potential carcinogens, this is the first area of contact, so the chance of it hitting here is very high. Avoiding smoking, avoiding alcohol is extremely important in prevention of stomach cancer. This is a cancer which actually in the whole world has been reducing ever since refrigeration started. It has been reducing all over the world because some of these carcinogens like nitrites and nitrates have actually reduced. But unfortunately in India, we still resort to a lot of processed foods. It's actually increasing. Wherever in the world, smoking of fish or grilling and all these, where there's a high degree of cooking with a lot of hydrocarbon residues there, these carcinogens have time to act in the stomach and cause these cancers. So avoiding a lot of these excessively salted foods. In India, we also use pickling as a very common technique. So it's an easy way to get some kind of foods that we like, which are spicy as well, but these can also, excessive salting can also contribute to stomach cancers. Apart from just salt, even high smoked food, smoked fish, smoked meats can also lead to or at least assist in causing these stomach cancers. In addition to this, having excess weight, obesity is also a risk factor. And if we can take care of our health and avoid weight gain, we will definitely be reducing our risk of stomach cancer, apart from many other health benefits that we have. There is an increased industrial exposure also in some industries like asbestos related industries like rubber industry, also in glass industry, silicosis and all that can also contribute. There are some other conditions like ulcer and all that which can mimic the early symptoms. So you can get a bit of heartburn, belching, you can have difficulty in swallowing, pain in the stomach. All these, if they're there, we of course think of ulcers first and take some medicines, antacids. But if they do not go away, it's very important that we investigate them, go to your doctor, seek help. Sometimes we may need endoscopy, particularly in the older people if these symptoms are persisting. These days we are unfortunately seeing it in younger people also, so I don't think any age is immune. We sometimes need to be aware that earlier this used to happen only in the later part of the stomach, but now we are seeing it in the proximal part, the upper part, which is where the food pipe is there, and these can be innocuous for a long time. So early diagnosis is extremely important because advanced cancers can be very difficult to treat. I'm sure together with all your help, with the help of your doctors, we will make sure that whatever the genetic predisposition or these environmental factors are there, we all hold hands together and reduce the incidence of stomach cancer.